I was wrong. There is a phase 3.
Yeah,
and
apparently.
And Error was yawning.
Yeah, sorry about that.
Not that you would have been able to tell if I hadn't pointed it out.
Yeah, that's happened a couple times, and I always try to move. I just moved the mic away to demonstrate by talking with my hands. I always try to move the mic away just to make sure you can't hear it. Because I have not gotten much sleep the past couple nights.
Anyways, welcome back to Let's Play Trauma Team. A new symptom observed. Fatigue.
Yeah. Guilty.
Guilty. Objection! Alright. Jokes aside, welcome back to Let's Play Trauma Team. I'm redxparasite.
You know, to give you an idea of the place that my mind is in right now, you said objection, and I immediately thought to the investigation court cases, and then about Phoenix Wright trying to use a cell phone that plays back the last words of a dead person in court.
Except he can't do that.
Yeah, but that's the first thing I thought of. Anyway, and I'm Air327.
And we're not done yet.
Yes, Doctor.
And this has been a weird intro.
Yes, it has.
Ah, damn. Something isn't right, Roni. Let's hurry.
Alright.
This is true.
Metastasis of the tumors is expected. Continuing diagnosis. Oh my god. Phase 3.
I thought there was an 8% chance they weren't tumors.
There is a 0% chance that they are not
Doctor,
tumors.
what am I ill with?
I can't say for certain yet. Sorry, but I need to run.
This must be frustrating for her.
Yeah.
Considering that we've diagnosed 2 different conditions.
I understand.
Mm-hmm.
I have faith in you, Doctor. There's something I need to tell you.
Is it a new symptom?
Well, yes. Seriously, this cold season's been really tough recently, hasn't it?
I'll take your word for it. Ooh. EKG.
I don't know why, but
Oh, that's
my
not a good
chest has
sign.
been hurting for a
Looks like it
while.
might be a heart problem. Especially since we have the EKG to look at.
Oh, yeah. Yeah,
Looks like
definitely.
she's in a lot of pain. Roni, did you make a note of this?
Understood, Doctor. New symptom observed. Chest pains.
If this keeps up,
Can we, like,
Oh, coughing.
flag that for coughing? Probably. Yeah.
She seems to be coughing a lot. Could it be her lungs or bronchi? Roni, let's record this too.
Understood, Doctor. New symptom observed.
I just noticed she has a coughing pose.
She does.
I'm sorry. Anyway, I won't be able to work if this continues.
Well, obviously.
I won't
Yeah.
have to be hospitalized, will I, Doctor? I'd have to rearrange my schedule.
Definitely a symptom. Alright, we're definitely gonna hear things now, like in the heart. Oops. Or not? That seems normal, actually. Maybe her lungs.
Hmm.
I guess not. Yeah, that looks fine, too.
Hmm.
Maybe it's something else. Yep, those both look fine.
Yeah.
And that's fine.
Alright.
I think it's funny how I just know what the normal sounding bowel movement is, and it's just like, yep, or nope.
Yeah.
Uh,
I think I might have seen where it looped because there was a small gap.
uh-huh. Oh, we can stop it.
Oh.
That's useful.
Yeah.
Yeah, I'm not seeing anything. There's like a slight bit, you know, slight blip, and then
Yeah,
the big
go
spike.
back.
So yeah, like that one looks completely
Yeah,
normal.
are there 2 blips at the end on the bottom one?
Yeah.
Okay.
Here, I can. No, that's not an abnormality. See?
Yeah.
So I don't see anything on the EKG.
Yeah, I don't either.
Doctor.
Oh.
Are you all right? If you're not feeling well, we do have beds ready.
Oh no. It just seems like the chest pains are getting worse.
Her
That's
symptoms
not
are
good.
getting worse. We need to redo all the exams.
Now we're probably gonna find new things.
Mm-hmm.
Make the
Oh, that's fun. Are the questions the same?
Um,
Oh.
when I was coughing,
Okay, that's
Just
different.
now, I tasted blood.
That's definitely a
Oh.
thing.
Taste
Yeah.
of blood. This is
That's
good.
bad.
Roni, add bloody sputum to the list.
Understood, Doctor. New symptom observed.
Fancy word for
Bloody
saliva.
sputum.
Mm-hmm.
Even though saliva is kind of a fancy word for spit.
I can't believe this. I had the kidney transplant. My life was going well. Doctor, it's getting hard to breathe.
Yes, that is probably related.
She's suffering from
Dyspnea.
a mild case of dyspnea. Roni, you got that one?
Understood, Doctor. New.
Okay, that's it. For the questions.
Hmm.
I'm betting we're gonna hear something now.
Yeah.
Okay, not there. Oh, yeah, her breathing's really weak.
Oh, yeah.
These respiratory sounds are weak. What about in other areas? As I thought, the other areas are normal. They're only weak in the lower left lung.
Only
Some form
one
of
lung.
abnormality, for sure. Roni, get approval for an X-ray exam.
Understood, Doctor. The X-ray exam is now available.
So that's why you need to check both the lungs.
Mm-hmm.
Because this one will sound fine.
Yeah.
Yeah. Nope. Alright, so that was it for...
Do you want to check the EKG again just to be safe?
Yeah.
That looks pretty much the way I remember it.
It would have been nice to know that we could stop it before. Yeah, it's not.
It's weird that you can see that gap.
Yeah. Anyways, we have exams to view, I believe.
Doctor, the patient's X-ray images are ready for viewing.
Sounds good. Let's see him.
I'm glad the game doesn't actually make you wait, you know, the
Yeah.
amount of time that it would take to get these done.
Right.
I assume that you probably see other patients, you know.
Yeah, there's something in the...
Oh, yeah,
Yeah,
right
there.
here.
White shadow in the lower part of the left lung.
Makes sense with the...
Definitely a sign of fluid
I was about to say,
accumulating
like,
in
some
the
sort
lower
of
left
fluid.
lung.
Yeah.
Well, it makes
we know
sense with
she has a
the
lung
breathing
abnormality.
being
Weak.
Let's narrow
weak
down
in the
the
lower
candidates.
left lung.
Yep.
Understood, Doctor. New symptom observed. Pleural effusion.
Oh, that's a fancy phrase.
There are fancier ones, but yes, I agree.
Yeah.
Doctor, would you like to narrow down the diagnosis candidates?
Yes.
Of course. That's why I came here, right?
Ooh, fun. All right. Acute bronchitis, a condition in which the bronchi become inflamed due to bacterial and viral infection. Include chest pain, coughing. I'm assuming they mean bloody sputum when they say that, yeah.
Mm-hmm.
And dyspnea. Abnormal breathing can be formed. There are no symptoms that appear through an X-ray exam, but a blood analysis will detect a high white cell count. All right, so it doesn't look like that.
Yeah.
Carcinomatous pleuritis, a condition in which the pleural membrane covering the lungs becomes inflamed. Symptoms such as chest pain, coughing, bloody sputum, dyspnea. Chest pain worsens through coughing, escalation will respiratory attenuation, and an X-ray will show evidence of pleural effusion.
Carcinomatous pleuritis. All her symptoms.
Yeah, we just
apply
need
to
one more.
Mm-hmm.
CT
Need a
exam.
CT scan to
Yeah.
confirm the diagnosis, though. Roni, how's our patient doing?
She's not doing well, Doctor. Please return to the examination room immediately.
Should we bother checking the other ones, or probably just move forward?
Considering the game is like, you should keep going, we could probably just move forward.
What does that sound though? It's like, did she like kick the floor or something?
Yeah, I don't know.
Otherwise, Why did it sound like something like fell?
My chest. It really hurts bad now, Doctor.
Her condition's worsened even further. We can't continue on with the diagnosis. Roni, request a room immediately. She needs to be hospitalized and her symptoms need to be treated.
Doctor? No. I can't just let the symptoms be treated.
Huh? Do you know how much of a risk you're in right now?
I finally thought that I could live. I had a new kidney. I recovered from the operation. I could finally live a life on my own. So please, Doctor, please find out what's wrong with me. Please cure me.
Alright, let's make it quick.
Roni, cancel that hospitalization order. Let's finish the diagnosis.
Music.
All right.
With all due respect, Dr. Cunningham,
What? You always rant about how I need approval from the patient when it comes to performing exams, but you won't listen to the patient when it comes to hospitalization and diagnosis? When things are inconvenient, we should push all the responsibility onto the patient? Spend all day worrying about how to avoid a lawsuit? To hell with that!
understood. Even I find incongruities with the protocol that I have been designed to conform to. I think I shall add, to hell with that.
My thoughts exactly. Right. So it's x-ray time again.
The humor in
Order a
these
CT
sections
scan
are
as
great.
well.
Understood, Doctor. The CT examination is now available.
Alright, so now we can do the CT scan. Okay, so I'm pretty sure this happened last time. Do we remember what we were supposed to be looking
On the
for?
display.
No.
Oh gosh.
I remember seeing that it involved the CT scan.
But-
Oh, you're gonna go check.
Let's go and check.
The patient, please.
Oh.
We can't go back and check. No.
We're bad at this sometimes.
Oh, this one might actually be easier. It's probably actually, you know what? If I had to guess, why don't we just
Go towards the one that
Skip.
represents lower.
yeah, let's just start from the bottom. Wait, we're looking for the left lung, right?
But it's her. Well, actually, yeah, I think you're. Yeah.
Her left lung is on this side.
Yeah. Well, I was trying to determine for sure what was forward, but yeah, you're right. Oh, there's two. Oh, but no, those two weird-looking dots are in the example. Those are probably. You know what? I'm not gonna say anything. I'm probably just gonna sound stupid and be wrong.
Jeez. This is more difficult than
Yeah,
I
and you
thought it
went
would
all
be.
the way to the end.
Oh,
I was gonna. I
Yeah.
just noticed that, and I was about to say go back, and then you noticed
Found
it.
something. Tumor shadows. Roni, make a note.
Understood, Doctor. New symptom observed.
so I've gotten in the habit of just cutting it off right after she says new symptom observed because it comes up
Oh yeah, yeah.
there anyways.
Put them on the display.
Wait, what?
Doctor,
Oh, there's
Yeah.
more.
Huh. I mean, evidently there is because it won't. Oh,
Oh.
there's another X-ray.
Oh. Oh yeah, that's definitely not normal.
On the right side, or
At least I think what I. Yeah,
talking about?
yeah. That looks different. Definitely different. Just once it reconnect this to point, yeah, that's definitely.
What the hell is this?
What?
You hear the music?
Hey,
Change it again.
Roni, this shadowing.
I anticipate this is a new symptom, as it was not confirmed by the previous X-ray.
New symptom? Don't be ridiculous. I've never heard of anything like this suddenly popping up inside someone. Roni, collate the data and check what it is.
Yes, Doctor. One moment, please. There is no matching data. It is an unconfirmed symptom.
Damn
What?
it. What's going on?
What?
There is a less than 1% probability of ascertaining what it is from the data at hand. I recommend that you remember the shadowing for later and continue with the diagnosis.
Huh.
Yeah, you're right. I can't spend any more time on this. Roni, let's continue with the diagnosis.
Alright, will you let me leave now? Okay. Yeah, that was unexpected.
Yeah, that's weird.
We should have all the symptoms now.
Understood, Doctor.
Some really cool music. Yep, tumor shadows on the lung.
Mm-hmm.
Okay, there's definitely not a stage 4.
Carcinomatous pleuritis. But I'm not convinced. Skin to the small intestine. Small intestine to the lungs? How can a focus that devours the human body at such a rate exist?
Doctor,
Oh, sorry. What is it?
no further progress can be expected at this point. The diagnosis will be completed temporarily. I will leave the cause of the disease as unknown and call attention to this case.
Yeah, you've got no other choice. I'm stumped. What am I supposed to tell her?
Well done, Dr. Cunningham. Ending the diagnosis.
What do I tell her? Not my problem.
Yeah, pretty much.
Doctor, are you all right? Is something wrong? Please, you can say it. What's wrong with me?
I'm sorry, but I can't say anything for sure yet. Please be patient. I want to keep you hospitalized a bit.
That's fine, Doctor. I'll put myself in your hands.
I'm sorry. I promise I'll do everything in my power.
It's not really the thing you want to have to tell someone.
Mm-hmm.
Hey, Roni.
Do you need my assistance, Dr. Cunningham?
Jeez, it's part of the security system.
Another little trick of yours, huh? Sounds useful.
I can utilize this facility's entire installation network.
All right. So, what do you think about that patient?
I found no reasonable matches within the current literature. I suspect it is an unidentified
There's one
condition.
good thing that a computer can do. It can search through
Yeah.
lots of
For
existing
once,
literature.
I agree with you.
Mm-hmm.
It mirrors Kaposi's sarcoma, but it spreads much faster.
I estimate the entire lung will be affected within 20 days.
Oh, jeez.
We don't have time to sit and think. We need to treat the skin, lungs, and small intestine all at once.
An operation
Doesn't
like
sound
this
that
would yield a
difficult.
10% success rate.
Sounds very difficult.
Yeah.
There's no other options, though. I'm stumped.
Should I request a hospice transfer and notify her family?
The earth was blue, but there was no God.
I
all
asked you a
we
yes
could.
or no question.
Now, we just have to hope for the best.
Yeah, pretty much.
One thing I've learned over the years, never give up.
Oh, hey, it's that guy.
I'll be assisting.
Is he actually having an
Specialist coming
inspirational
in for
moment because of the jackass?
That's it! Roni, you said you have access to the full facility, right?
I did, Doctor.
All right. I want you to look up OLCVR data. Records, footage, surgeon name, contact info, everything. I promised I'd do everything in my power. Well, I guess I gotta follow through with that.
Scalpel, and the Coker's forceps too. Hurry.
Isn't the boy just superb? Now are you glad he's here?
Yeah, thanks to you. I'm in your debt.
Probably CRSO one.
You threaten me so you can use him, and then you thank me?
Hey, no threats. I just asked you to lend him to me.
Of course not. Still, I have to say, it takes guts asking for such a big favor to save your patient. Well, son, I guess you and I are square now.
To save a patient, huh? That's nothing noble like that.
Some really cool music.
Yeah.
You know, we keep saying that, but
Oh, I
So-
guess it's gonna be a while.
if I had to take a guess, so we're still in this row. I would guess that this one's probably the
The
same
patient we just diagnosed.
So do you want to try to go for it? We're at about 20-ish minutes.
I mean, I just almost hit my head on the thing behind me. I mean, if you want to do that, then okay.
Okay, we'll go for
I
it.
have to adjust my microphone 1 sec.
And you'll also have to, you know, pick up your remote.
That too.
You can't just get away with pointing to things.
That was a fine operation, Doctor. Thank you.
He's remembering back to what Hank said.
Life.
Yo, kid. Came by to see what you're up to.
You know, just kind of being a capsicle. That's one of my favorite lines. I forget, is it? I think it's the first Avengers movie.
I didn't think you'd be living in a refrigerator.
Temperature's kept at 0 Celsius to reduce bacteria. And so I can't kill anyone.
Bacteria cultivation, huh? Pseudomonas, Vibrio, Micrococcus? You know, plenty of bacteria can be grown at this low temperature.
And you are?
Gabriel Cunningham. I'm in charge of the guy you worked on.
What's his name?
I want to consult
which
with
guy?
you about
That
something.
guy.
Consult with me.
Diagnosis guy.
We've got a patient with tumors similar to Kaposi's sarcoma. Skin, lungs, small intestine, they must be excised at once. How about it? You think it can be done?
There's not enough information to make a conclusion. But depending on the patient, I won't rule it out entirely.
Is that so? All right, it's decided. Let's go.
What are you talking about?
The operation. You'll be performing it on that patient.
Me?
What's wrong? That's why I came out to see you.
So yeah, CRSO1.
Please check the arterial forceps.
He's a good
All
doctor.
the medicines ready?
We're running late.
But at the very least, she's a very talented surgeon.
Putting extra trays here. Where's the anesthesiologist? Oh, come on in. You're late.
You are...
Maria Torres. I'll be assisting you this time. You've heard the details, right? Read the charts, too.
all right?
I have seen you before. Have we met?
I hear this is a tough condition to deal with.
Yeah, you're right. Let's start the operation then.
Yep, Shelley
The
Brooks.
focus of this operation is tumor excision, but,
But
well, it's odd. Infections like this aren't all that rare. Even so, we can't pinpoint exactly what's causing them.
what do you mean? Have you done a blood analysis?
Please. Of course we did. Do you think we're stupid? Nothing showed up on the CRP, antibody titer, or WBC count.
Do you know what this means?
Nope.
Because I don't.
Other tests came up with nothing too. We're stumped.
Oh, that is indeed odd.
Well, hopefully this will be an uneventful op. Let's begin.
All right.
No, I doubt that.
All right, let's go. I'll take the drain. Oops, I don't want that. That. What else do I want? I think. Here, I'll give you. I'll put you in charge of the vitals.
Okay.
And the laser, too.
Well then, let's begin the operation.
Gabe, that is Dr. Cunningham, says it's like Kaposi's sarcoma. Who knows what it actually is, though?
The foci show discoloration, like malignant melanoma. Let's begin by treating the skin. Prepare
Alright,
the
so
laser.
these kinds of, like, smaller tumors you'll treat by using the laser. So it's just point and click
Watch
A.
it with that thing.
Do
It's
I
not
hold it at all?
harmless, you know.
No. You just press it,
First
and
affected
that'll
area
take care of
removed.
those.
And sip-
They're all burned off.
And then do I
Get an
just
antibiotic
sort
gel.
of...
Yeah, you can just... Boom. And that's it.
Okay.
No, we're not done yet. There may be tumors under the skin here. I want to check the area. with
Alright,
the
so you're gonna have
ultrasound.
to use the ultrasound.
No, it's not. Now I like size of this tumor.
Nope. Okay. Thanks, Cam. Know how to do that.
I'll leave the trick.
And that's you.
Looks like all the skin
You
tumors
make
are
me
done.
look
Let's keep
terrible
moving.
at this game. I mean, I know relative to you, I am.
Alright, so
Still.
this you on the gel.
Oh, I'm supposed to be doing the job.
Also, apparently I have the syringe. So do I have 5 tools then, or do you have the sutures?
Now,
Don't know.
First, we need to inject blue medicine. Inflammation has subsided. Let's treat the rest too.
Yeah, you have the sutures.
Oh,
That's okay, we don't need to suture much in this operation.
I'm shifting my view.
Alright, so you're gonna... Oh, wait, do we not have to... Yeah, okay, you're gonna have to do that. So press and hold B when you're using the ultrasound.
Inflammations are all. Tumor presence confirmed. Treating it and inflammations.
Can you stop moving it around?
Oh, sorry.
that's the first one. Keep going.
Antibiotic gel, yep. Alright, you're gonna have to...
That's number 2. Looks like there's another
I
one.
can't operate while you're moving it around, just heads up.
Oh. It's annoying.
Alright, you're gonna have to shift the field down, probably down. Yeah.
I said into.
Alright, I see it. You don't have to...
Third tumor has been extracted. Now for the inflammation.
Alright, to the left, I think. Yep.
The small intestine has been treated.
Alright, I think we're
Okay.
gonna have to move on to the lungs. Yep.
I know. You're
Get ready to shift the focus of the operation.
Also, if there's one thing that the game's nice about, you don't have to worry about
Prepare the laser.
laser and then gel. Yep. Yeah, this game's nicer in that it will actually tell you about the things you need to use on the various different tumors. Such up.
Pulse section is like only.
Yeah, I think the tumors won't actually appear
There's
until
tumors here too, right?
you get rid of
Fine
all
with
of
the
those.
ultrasound.
I found a tumor. Scalpel.
It's not a tumor. Is this?
This doesn't change our treatment. Let's continue.
Or you're gonna have to use gel on those.
There has to be more.
This must be the cause of that mucus. Beginning exoma extraction complete. That should stop the mucus.
Probably down. Yeah. Gel.
Tumor markers aren't decreasing. Must be the mucus.
What is this? Some kind of bruise?
That proves.
Hey,
Over the top anime reaction. All right. Keep searching.
One exoma extracted. It's not over yet. There should be more.
All right. We'll probably have to move up. Gel. Oh, yep. There are probably tumors around where those are forming. Yep, I can't.
Oh god, I'm using just lasering everything. think I just lasered your marker for the laser.
Okay, take care of that stuff down there. There's... Yep. Here, you can take care of those two. Trying to like blindly search for them by just cutting in places. Oh, up here. Probably down. Oh, wait. Here, Joe. Now you probably have to move down.
Let me just go quick flash at the very top.
Oh. Yep, Joe.
Okay. I think I switched to it and then the icon disappeared and I confused myself.
I just moved down, yeah. Oh, there's probably a tumor around here. Oh, gotcha.
That's like myxoma, is it?
Yes, I'll start treating the mucus and the remaining wounds.
Alright, cool, that's it.
Okay.
Whew. We can finally relax a little. All right, let's close this patient.
Alright,
up and
sutures
finish
are
this
on
off.
you. I can't believe you still got a goal for that.
Where would you see some?
Let's finish the operation.
If you had probably gone backwards, you probably wouldn't have gotten it.
All treatment has been completed.
I can't either.
That was awful.
Well, because I think the game looks for a certain number of sutures. Like, if you do too many, then it'll subtract from your score. And then I think it also looks for, like, the right progression, making sure that you're
Moving left to right.
moving left to right enough. Like, especially with the ones that are, gaps, like suturing the incision like that. If you're not wide enough.
Yeah, but like, I sutured half of it and then, like, drew a line across.
Yeah. We got all the special bonuses and we got all cools, so.
Nice.
Can't imagine we would have gotten anything less than that.
Yeah.
Huh. That was quite a show. Looks like we can trust you.
I'm just doing what I was brought here to do.
Sheesh, aren't you fun to be around? Take a compliment.
You've paired probably like the most stoic person with the least stoic person
Yeah.
on the team.
Yo, how'd it go?
All the tumors have been extracted. It's a unique condition, so keep her fully monitored.
You're just leaving now? That's pretty irresponsible.
I'm a prisoner. I can't do anything else from here.
Well, not exactly. You're responsible for that patient until she leaves.
I heard that you'll be in custody here for a while. Let me tell you that I'm firmly against this decision.
The new room's over there. It's barred, but it's no icebox.
So he'll
We'll
be sticking
counting on
around.
you to help us save lives here, kid.
Which, we couldn't already tell from the fact that he has an entire storyline.
Yeah.
Satisfied?
Are you kidding? I need to see how he does before I decide. Besides, his entourage is a pain in the ass, too.
What do you mean by that?
Don't treat me like an idiot, G-Man.
Oh my god, it's G-Man.
Oh my
I see a
god!
lot of new faces around here. Curious faces.
Wake
Dr.
up,
Whoa,
Mr.
whoa.
Freeman.
Try not to get involved in other people's jobs. Let's just agree not to interfere with each other. Got it?
Thanks for your cooperation.
Okay then.
Yep. Alright, so we're doing well on the surgery so far.
Yeah.
Alright, next time on Let's Play Trauma Team is more forensics.
Alright.
So thank you very much for watching this episode. It was a little bit longer, but we got a lot packed in, so hopefully the latter half of this was a little more exciting.
Yeah, probably.
Thank you very much for watching.
Hopefully you enjoyed watching me fumble around with the controls while Red X does everything in a quarter of the time I could possibly comprehend what I'm supposed to be doing.
All right. So thank you very much for watching. I've been redxparasite.
I've been Air327.
Signing out.